Even though a light night sweat every now and then is typically nothing to worry about, persistently heavy sweating that soaks your clothes and bed sheets may be a sign of a severe illness and should not be disregarded. Among other symptoms, this kind of night sweat can be brought on by infections, neurological diseases, specific types of cancer, hormonal abnormalities, and other medical disorders. Keep watching because we're going to talk about the reasons for night sweats, when to consult a doctor, and how to have a better night's sleep. What causes night sweats? Your blood arteries initially enlarge when you're sleeping, increasing the blood flow throughout your entire body. This vasodilation is momentary, and the blood vessels quickly constrict once more to resume normal blood flow. However, physiologically, this might cause a sudden wave of heat to spread throughout your body. As a result, you'll sweat, get a flush, and your heart rate will go up. Many things can cause you to perspire at night. Sweating when sleeping is common if it's hot or uncomfortable in your room. It also occurs when you consume acid-producing foods such as citrus, spicy, or high-fat foods right before bedtime. In these situations, you shouldn't be concerned about night sweats. On the other side, nocturnal sweating may occasionally be a sign of a medical issue that has to be treated, and we'll dive into these. 1. Diseases. Certain diseases could result in night sweats, like brucellosis, a bacterial infection, endocarditis, an infection of the inner lining of the heart, and AIDS and HIV. Infections frequently result in other unsettling symptoms in addition to night sweats, such as chills and fever, joint and muscle ache, fatigue and weakness, and weight loss. 2. Changes in hormones. Hormonal problems might also cause excessive night sweats. These problems are typically due to hormonal treatment for breast or prostate cancer, perimenopausal and menopausal hormone fluctuations, estrogen deficiency, and hyperthyroidism. 3. Undiagnosed cancers. Cancers such as leukemia, nodular lymphoma, lymphoma of Hodgkin, carcinoid growths, neuroendocrine tumors, and myelofibrosis, an uncommon bone marrow cancer, could cause night sweats. Additional signs of undiagnosed cancer include continual tiredness, chills and fever, weight loss, chest, stomach, or bone discomfort, and enlarged lymph nodes. 4. Medicines. Newly prescribed medication may cause overnight sweating. Certain drug groups such as antidepressants, methadone, diabetes medication, cancer therapies, blood pressure drugs, and drugs for inflammation and pain like acetaminophen and aspirin. Stay tuned because we'll be covering treatment options for night sweats, as well as when to see a consultant. 5. Psychiatric and neurologic conditions. Mental and psychiatric conditions can also result in night sweats. Issues such as problems with alcohol consumption, drug dependency, panic or anxiety disorders, and depression could lead to night sweats. Other typical signs of these conditions include agitation, anxiety, and insomnia. Mental illnesses, including depression and anxiety, are linked to obstructive sleep apnea. Although this occurs less frequently, neurological conditions can also cause night sweats. Damage to autonomic nerves, overreaction of the involuntary nervous system in response to stimulation, known as stroke reflex, or a cyst in the spinal cord can actually result in night sweats. 6. Other causes. You may also be perspiring excessively when you sleep due to conditions such as the flu or a cold, disease of gastroesophageal reflux, GERD, diabetes, immune system diseases, or no known causes, idiopathic sweating. If you experience frequent night sweats that keep you up at night, or are accompanied by other unsettling symptoms, you should speak with a sleep physician. When should you consult a sleep expert? You probably don't need to worry if you don't sweat frequently when you sleep, and it does not interfere with your sleep schedule. However, it's best to talk to your doctor about concerning nighttime sweating. Some of the alarming signs of night sweats that should be evaluated by a doctor include random weight changes, body pains, chills and fever, prolonged cough, or bowel issues. What are the treatments for night sweats? Your sleep physician will inquire about your medical and family history and any additional symptoms you may be experiencing. You might get a physical examination, laboratory tests, or imaging tests identifying suspected health conditions. How can you stop night sweating? If you're experiencing frequent night sweats without any other alarming health symptoms, you can try remedies such as dressing comfortably and loosely for bed. Also, use light bedding and coverings that are simple to take off at night to keep the room cool. Throughout the night, sip cool water. To keep your head cool, place a cool pack under your pillow and flip the pillow over. Avoid caffeine, alcohol, spicy foods, cigarettes, and evening exercise, as these can promote night sweats. However, you should exercise regularly during the day to reduce your anxiety and restlessness. If all those things are in order and you still get night sweats, consult with a sleep physician to get a diagnosis and assistance in returning to restful sleep. Help is available.